Hi, this is Dr. Khanna, PI surgeon from Beverly Hills. What is PI? PI is an acronym for Presbyopia Implant in Eye. So let us see first what exactly is presbyopia, why does it occur, and if there are any other alternative treatment methods, and why PI is superior to all of them. Presbyopia is the inability of our eyes to see things at close, middle, and far gradually as we cross 40 years of age. The reason for this is happening is normally when we want to see something near, our muscles, which are called ciliary muscles, contract. When they contract, they make the natural lens more spherical, increasing its power and decreasing the focal length. That means when the object comes from far to near, the power of the lens increases, so the image can still be formed on the retina. But as we age and take circles around the sun, we keep getting new fibers of the lens material being produced. And since there is no place for them to be drained out or removed, they keep getting accumulated. Very much like the stem of a tree, where you can see annual rings. Same way, more and more fibers are being packed from the side and the inner ones get compacted. There comes a time when the lens becomes so thick and inelastic, its shape cannot be changed. This is also enhanced by the weakening of the strength of the ciliary muscles. For two reasons: with age, all our muscles do weaken, but also as the lens becomes more thicker, the force length relationship gets affected. So now we have inert material sitting there, that's our natural lens fibers made of collagen, which are not really working. So what have we been doing all these years is using glasses or contact lenses or some sort of monovision. But these are just treatments and not cure. Just like when you have blood pressure or diabetes, you're taking tablets or insulin injections, those are treatments, not cure. But PI or presbyopia implant in eye cures presbyopia forever. How we do this procedure is we make a small opening in the natural lens and remove the contents of the lens. We don't remove the entire lens, so that the new implant can be put in the space where the old material was. So basically it's an exchange of the lens contents of the eye. The new implant put is biocompatible, it's synthetic. What that means, it is artificially made of acrylic or silicone, but the eye does not react to it. It has special design features based on the type of PI it is, which we will discuss soon. And it has to be placed very accurately in the center of the eye, right near the nodal point, so it can work very well. There are certain people who will not qualify for PI procedure. That's why we have to do a very thorough preoperative check before deciding to go ahead. These includes corneal pachymetry mappings. That means analyzing the thickness, ruling out keratoconus, looking at the optical zone with the topography, that is the shape of the eye. So pachymetry, color topography, then we need to rule out macular degeneration, so we do macular scans, which are like 3D scans, almost like an MRI except done with light. We rule out glaucoma with visual fields, optic nerve measurements. All these have to be perfect before we can qualify a person for PI. And that's why the outcomes become so much better once we know the basic health of the eye is good. And yes, one more thing, dryness. We know PI does not cause dryness, but a lot of people in this group have dryness. We just want to make sure they don't have very advanced dryness where they're not producing any tears. So once all these are normal and the patient understands what they're looking for in terms of outcome, the PI procedure becomes much easier. In our next topic, we'll discuss the types of PI available.